Stroke Awareness Month just wrapped up, but we're keeping the conversation active. Strokes are the 5th leading cause of death in the U.S., but the good news is that they can be treated and prevented. Today we're speaking with Dr. Kara Sands from the Mayo Clinic to learn more. Good morning, Kara.
Good morning. Thank you so much for having me.
Thank you for joining us. So let's start out with this. What exactly is a stroke?
So a stroke is any time there is either interruption of blood flow to an area of the brain, perhaps by a blood clot, or if we have blood that spills outside of a blood vessel where it doesn't belong and ends up injuring a brain. Technically, those are the two types of strokes. The blood clot types make about 87%, the majority of strokes, and then the rest are hemorrhagic strokes.
So what are the symptoms and how can you tell if you or someone that you know is currently having a stroke?
Sure. Some of the most common signs and symptoms of stroke, we like to think of the FAST acronym, F-A-S-T. So face, facial droop, droopy face. One side of the face doesn't look like the other side does. A for arm, arm weakness, arm drift, weakness on one side of the body. S is for speech, slurred speech, inability to speak. The speech is coming out, doesn't make sense. The patient can't really understand what people are saying to them. And then T is for time. It's time to call 911 to get emergent evaluation and help. Time is also brain. The quicker that we can evaluate an acute stroke patient, the faster we can do tests to figure out what's going on and determine what tools do we have available to help that patient so that they don't have further injury to their brain and prevent disability. You're completely right that approximately 80% of strokes are preventable, they are treatable, and I like to say they're beatable as well, so we'll try and be positive about that.
So the best thing to do if you recognize any of those fast symptoms is to call 911 immediately.
Absolutely, because that is going to, when the ambulance picks up a stroke patient and brings them to an acute stroke ready hospital, everybody is ready to go, prepared, hands on deck to give them the acute care.
So what are the treatment options?
The treatment options available for acute ischemic stroke for patients who are arriving within the 4.5-hour window and are appropriate candidates for TPA. It's a clot busting medication, so that's the first thing that we can offer for acute ischemic stroke patients. The second thing we can offer for appropriately selected patients who have a larger blood clot, something we call a large vessel occlusion, we can offer endovascular interventions where we can go into the blood vessel and remove and pull out the blood clot to restore flow and prevent further injury to the brain. Those are the two main available treatments for ischemic stroke. When speaking of hemorrhagic stroke, lowering the blood pressure is paramount, and then also trying to understand why did the bleed into the brain happen. Was it because of a ruptured outpouching of a blood vessel, such as an aneurysm that would need to be surgically addressed, or was it just because of long-standing high blood pressure that weakened the small blood vessels and led to a rupture? And our treatment options are tailored according to the patient and their needs at that time, but the most important thing is to get your patient to the appropriate facility, the nearest ER, by calling 911 so that the ambulance can bring them there so they have the best chance of getting imaged, diagnosed, and treated appropriately for what they need.
And where can our viewers go for more information?
So you can go to the Mayo Clinic website and search for stroke. You can also go to the American Heart Association, American Stroke Association website, which are both excellent references.
Thanks, Kara. Mike, back to you.